Ladies and gentlemen, the coronavirus epidemic is a serious challenge for the whole world economy. I just have finished an EIIW working paper, 270, and it looks into these macroeconomic effects of the coronavirus epidemic. In this year, we are celebrating 25 years anniversary of award-winning research. Well, that might be a little bit difficult to organize as initially planned, a big workshop. But our research interest, of course, is quite strong in the sense that we want to understand where are the major challenges, where are the problems, and what are the policy options and implications. So basically what we can say is that the coronavirus, which started in China in basically January 2020, the epidemic there quickly was spreading, and we can say that now in early March, probably the worst in China is over. But the coronavirus is spreading now everywhere. It is in Korea with many infections. It's visible in Iran. It has affected Japan and, of course, also, as we know, Italy and many other countries in the EU, and it's also affecting the US. It puts the health systems everywhere to a stress test. And it's very important that the authorities have a strict policy in the sense that the peak should be postponed. The peak of this epidemic should be postponed through adequate measures. And actually, if it is postponed, the peak becomes smaller. And then the problem that you might not have enough intensive care facilities available for the seriously infected patients is then not such a big problem. In Italy, it seems to be a problem in early March. And of course, we see that the coronavirus brings a supply side shock. Basically, intermediate products, internationally imported products are not available as usual. So this is a supply side shock, and there is also a strong demand shock, which possibly affects the non-tradable sector more than the tradable sector. In the SARS epidemic, basically was the perception then in 2003 that the demand shock was a little bit more important than the supply shock. Now this pandemic, it's according to the World Health Organization, an epidemic which affects actually the world system. So now the challenges are much bigger, and one particular aspect concerns the tourist industry. The tourist industry has a high share in national output in many countries, also in some European countries. But also in countries you might not expect immediately. So, for instance, Jordania and also the Lebanon. The Lebanon already is a country on the brink of bankruptcy of government. If then, as I assume in the paper, the tourism sector would shrink by 50%. This would have dramatic consequences for many countries, but also for these small countries, in this case Lebanon and Jordania, and both have a lot of refugees. And there can, of course, be also then a problem if refugees do not have decent health care, if the refugees are neglected by the national, regional and local authorities. So these countries need help, because otherwise there will be a problem of uncontrolled refugee dynamics during a period where we are facing a pandemic, and that's certainly very risky for many countries and many people. So I can just give you some figures to illustrate what does it mean if tourism contracts by 50%. So for instance, in Thailand, output would reduce by 6.5%. In Portugal, it would reduce by 5%, the same roughly in Greece, and also Luxembourg, Bulgaria, Estonia, and many other countries are strongly affected. Even Germany, we have roughly 2.5% of our GDP in tourism. And do not forget there are additional complementary services which would be negatively affected. There are multiplier effects. So if we have a 50% reduction of tourism in Germany, immediately you would have to revise the output forecast for 2020 compared to what we had in autumn 2019. For instance, then in Germany, the GDP growth rate would reduce by about 1.5 percentage points. And Germany, as a country which is very strongly oriented towards export of goods and services, well, we would be very much affected by economic contraction, for instance, in our European partner countries. And then there's a problem in the US, and the US spends 18% of its GDP on healthcare. For instance, Germany or France here in Western Europe, just 12%. The longer life expectancy is here in Western Europe. The lower infant mortality also is in Western Europe, so the US has some inefficiencies in the healthcare system. Hospitals roughly have 3 times the prices which are charged here in Western Europe, and the epidemic, the corona epidemic, puts every health system really to a stress test. As the United States has 13% of the population right now which are not covered by health insurance, there is a serious problem in the sense that these poor people or these people without health insurance have usually an incentive to see the physicians rather late. That's not a good reaction pattern when you are facing an epidemic. And the United States statistics also look a bit strange. Colleagues from Johns Hopkins University had already made some forecasts for the corona epidemic figures in the US that was published in late January. And my impression is that the Trump administration did not really pay attention to this. So if the Trump administration is not successfully coping with this challenge, that might well have an effect, of course, on the presidential elections. And if then Trump is not re-elected, this in turn will affect the position of Prime Minister Boris Johnson in the UK. His position in the negotiations with the European Union on a free trade agreement would be very seriously weakened if Trump is not re-elected. In the paper, I'm also actually looking how one can understand the more long-term problems in the context of a modified macroeconomic growth model. I'm using a simple modified solo growth model where the epidemic affects the growth rate of the population on the one hand. On the other hand, I have an important variable, which is the coverage through health insurance of workers, and the higher the health insurance coverage rate is, well, the higher is effective labor input in the macroeconomic production function. If all people have health care insurance, then people will hopefully see the doctor relatively early. You can avoid serious illness, and you have less people who are ill, who have to stay at home, or who actually might die from a serious illness. And that means you have a higher effective labor input. This aspect has been much neglected in the literature, and I think it's very important that macroeconomists take a closer role at the role of the quality of the health system for macroeconomic outcomes. So this is all very important.